I will call upon our next speaker now, the Reverend Canon Nwachukwu Okeke, Education Secretary, Diocese on the Niger, the Anglican Communion, for your perspective, Reverend, Mission School perspective. Thank you, sir, for joining us from Niger. The floor is all yours. Thank you so much.
I want to appreciate Dr. Ada and her team for the privilege given to me to be part of this conference. I was asked to present a paper, COVID-19 after lockdown preparedness, education health of African children. The history of the Diocese of the Niger dates back to the Niger expedition of over 162 years ago. After the 1841 expedition, the white missionaries realized that Africa was best evangelized by Africans. This realization led to Samuel Ajay Crowther being given the privilege of playing a prominent role in the mission team to West Africa, especially the Igbo mission. Diocese on the Niger was the first Christian organization to establish schools and hospitals east of the Niger. For instance, Central School Odabu Onitsha has lasted over 160 years. Iyen Mission Hospital has lasted over 112 years. Dennis Memorial Grammar School Onitsha has lasted over 94 years. If we can share the slide very well, you see by my left-hand side, you see the oldest primary school east of the Niger, Central School Odabu. Then at the middle, Iyen Mission Hospital. Then by my right-hand side, you can see Dennis Memorial Grammar School, Onitsha. What we do as a diocese. The diocese has 172 primary schools and 57 secondary schools. We employed over 2,700 staff, tutorial and non-tutorial, and both at the urban and rural areas. We have more than 54,292 learners, both at the primary and secondary schools. The diocese provides education for 15% of learners in Anambra State. The proprietor, Bishop on the Niger, Right Reverend Dr. Nwachukwu, has been sponsoring all these schools by providing the necessary facilities that will enhance qualitative education and taking care of the staff welfare. The bishop earlier this year approved over 8.5 million naira, approximation of $25,000, as part payment to set up an online portal that will host the database of all our schools. On the next slide, the bishop has an interactive section with all the teachers under his diocese annually. Likewise, on the right slide, the learners do come to the cathedral for interaction with the bishop. And also the bishop gave out scholarship of 300 students to go to the school, tertiary institution of their choice to study over there. How the diocese is supporting the education of children in this COVID era. The Diocesan Education Commission has developed protocols for all our school heads to implement and make use of face masks and washing with soap for at least 20 seconds. Use of alcohol-based and sanitizers, and maintain social distancing in all our schools. It costed the diocese about $16,823 to provide all these measures. Below the slide, preventive protocols in our schools. We produce flyers and share to all the parents and well-wishers. At the same time, at the first slide, we were able to encourage them to use face masks and also hand washing, and also to avoid using hands to put into the eyes or the nose, and how to use hand sanitizers and also social distancing. How the diocese is still supporting education? The diocese embarked on online teaching using computer-based technique and alpha radio station to keep our children busy, which is effective, though it hinders teacher-learner relationship. And learner-learner relationship and also it is very expensive to maintain. For the parents who cannot afford the electronic devices, the smartphones, laptops, iPad, etc., or hindered by network services, we gave, okay, you can see the slide there, we gave them an option B. They come to the school, pick the hard copy, and send to their wards with exercises, after which they will return them weekly. Our schools organize Parent-Teachers Association meeting where they advise the parents to start observing the COVID-19 protocols. They were also advised to encourage their children to start using face masks at home and other places. What the diocese plan to do in the post-COVID-19 era: provision of clean water with soap, hand sanitizers located at the appropriate places in compound, do the needed assessment, and work out financial implications with staff and parents on actions to be taken, ensuring that social distancing is maintained, at least 2 meter spacing, and classes well ventilated. Classes can equally move to open spaces or outdoors. Constant compound cleaning and disinfection with ethanol and provision of waste bins. Our schools will embark on shift morning and afternoon to avoid being overcrowded while learning. The next slide, please. Ensuring that school clinic is functional and well equipped with a trained medical personnel, strict compliance with COVID-19 protocols, and ensuring that both staff and learners observe them, including visitors. Avoiding programs that will bring the children together, ensuring that children eat healthy food, drink enough water, and eat more vegetable, fruits with vitamin A and C. Encourage our children to do exercises and make sure they sleep well. Please, the next slide. Our challenges: staff welfare. The diocese has been paying staff salaries despite the lockdown, but cannot be sustained without assistance. This is because the learners do not pay school fees, and yet expenses have increased drastically. This is one of the major challenges we face. Inadequate facilities and manpower to tackle the two shifts. Boarding facilities cannot continue in order to maintain social distancing due to limited hostel that will accommodate the number of learners. Lack of interest. Many learners at the rural areas now dropped education for other things like farming and other menial jobs. Teaching is activity-based, but with current situation, teacher-learner relationship is strained. The costs incurred for 3 months during this COVID-19 are stated in the next slide. This is the next slide. The financial analysis is expenses incurred by the diocese. March, we spent $321,428 to pay the staff salary. If you go through, you see April, we were able to provide face masks, hand sanitizers, buckets, and disinfectant. The grand total cost is about $981,107. The next slide, please. The next slide. In summary, we provide education for a huge number of children and employ a substantial number of adults in our community. We have commissioned an online learning portal, implemented school-based learning protocols, and engaged with our parents and teachers and community to support teaching our children. COVID-19 has put enormous financial pressure on the diocese as income from school fees has reduced without decreased expenditure. We want to partner with well-meaning non-governmental organizations and corporate bodies to develop our online programs so we can continue to provide a high-quality education program for our learners in the 21st century. Thank you for patient listening.
Thank you so much, Reverend, for that very comprehensive talk and your financial breakdown. And thank you so much. I was particularly heartened being a public health professional and a physician when you talked about hand sanitizers and masks. We cannot stress and the importance of hand washing. You know, the lessons we learned as children, like wash your hands, it's so important. So again, thank you so much.
Thank you very much.
And it was a pleasure. And, you know, be safe, everybody there. That's what we all wish for. We have to be safe.